And now, a segment from the Best of the Night Side with Barb DiGiulio podcast. Listen and download the latest podcast at Newstalk1010.com.
Welcome back to the show. We have a great hour ahead. Dr. Stephen Mulholland is back. He is one of Canada's leading cosmetic plastic surgeons, and he is with SpaMedica. Welcome back to the show. It's great to have you here.
Oh, thanks for having me again.
How have you been for the past month?
Oh, busy.
Is this a busy time of year in cosmetic surgery?
Yeah, there's seasons now all year round, but the fall is busy for, let's say, moms whose kids are back at school and they've got things organized and they want to get ready for, let's say, Christmas, the holiday season, Thanksgiving. So non-surgical and surgical enhancements are very busy this time of year leading up to the holiday season. And then just after Christmas, there's award seasons. And then in the summer, it's moms whose kids are off to camp. And so it seems to be busy 12 months a year now.
There's a question I've been meaning to ask you, and I keep forgetting to ask you every time you're in. If somebody comes to you, and maybe this has happened, and says, what do you recommend that I have done? Is that a kind of dangerous territory that you might tell them something that they were thinking was actually looking okay?
There's two schools of thought. And when I was training back in the 80s, we were always taught not to recommend anything, but to follow patients' lead and what concern them. As I've gotten older now, and perhaps wiser, certainly older, I do two things. I always ask, give me your concerns. What are they? And I pay attention carefully to what the concerns are, what their goals and expectations are, make sure they're realistic. But then I've learned that patients don't always know what's bothering them. If they say, I feel I look tired, and this is what I think I need, I generally will end the consultation by asking them, do you want to know what I think, what I see? Because if I see it, then other people may be seeing it. And so I'll point things out that fit into their constellation of concerns. Meaning if their concern is they feel they look tired, there's 4 or 5 things: lower lid bags, maybe some blueness under the eye or dark circles. If it's droopy, it's jowls. And I may add some other things that may have contributed to that adjective. I think patients very much appreciate it because they really want you to help guide them, and they don't always know what procedures work for them, and they don't always know what's contributing to what bothers them. So I think a good plastic surgeon will listen carefully to the complaints, and some patients say, "No, I don't want to know what you think. I just what can you do
really?
with a bump on my nose?"
Okay,
but the vast majority say, "Absolutely, that's why I'm here. I want to hear what you think."
But if you see, for instance, something that could be done with their chin and they're not even noticing it, you won't bring it up?
No, generally not. If it's completely unrelated to their concern on presentation, then, everyone's inherently feels good about themselves, then they are by definition attractive. If it may not be classically in Da Vinci proportions be attractive, it doesn't really matter. It's more the patient's perception of self. So I don't bring up things that are completely unrelated to the patient's concern. I think that is random and exploitive, and I just focus on the constellation of concerns the patient presents with and throw a few additional concerns they may have in there.
Cosmetic plastic surgeon Dr. Stephen Mulholland is here. Can you even look at people anymore, even if you're out just socially, without sort of just looking at the face and going in your mind saying, I could do that, I could do that?
Yeah, it's an occupational hazard. And so,
I would think.
And so I teach every weekend somewhere in the United States usually, and aesthetic doctors, particularly young ones, I tell them to be aesthetic detectives to everyone that they talk to. And I do this all the time. Top 10 things I would do if I was asked. Top 10 things I would do if asked.
Interesting.
And you become an immediate aesthetic diagnostician. Of course, never tell anyone, you'll have no friends. So people say, "What would you do for me?" I generally say, "Oh, nothing. Come to me when you're old enough." Right. And she goes, "Well, I'm 76." I say, "Oh, come to me when you're old enough."
That's funny. And so, and then that's a good way, I guess, to be with your friends, because you don't want to. Yeah, you don't want to do that. But you must look. For instance, if I'm out at an event or a party, people want to know about the radio business. So, or I have trouble watching other broadcasters and I just see it differently than other people do see it. But you must get asked a lot when you're at parties and stuff. What would this cost and what would you do?
All the time. It's two things happen if you say, if I'm a plastic surgeon, you'll immediately get, well, I've been wondering about doing this or that procedure. What might you do? And they have to be very careful to just say, oh, you look great, Don't do anything. You look awesome.
Do you?
I say that even if they don't, because again, you won't have any friends. And then
Right.
the other thing that often happens is I've operated on 400 patients a year for 24 years.
Wow.
So I'll be out at some restaurant or some event, and of course, if I see a patient, I would never acknowledge that I know the patient, or someone would assume they've had something done. And so part of the privacy pact with your patients to completely ignore them, and then sometimes they'll come up to me when they come back to the office for Botox or something. Well, I saw you at this game or this event or that restaurant. You didn't say anything. I said, well, if I said something to you, your friends would assume naturally that you're getting treated. They go, oh, I didn't think of that.
That's good, yeah. And one of the things we were talking about the last time you were in, and oh, by the way, if anybody has questions for Dr. Stephen Mulholland, cosmetic plastic surgeon, the phone lines are open, 416-872-1010. Text us at 71010. We've talked about this laser alternative to liposuction that essentially melts the fat. And this is great if people have stubborn areas that they want to get rid of. But I'm reading a little bit more about the procedure today, and purely as research for our interview, of course. And I'm thinking to myself, people have this fat, say, on their stomach area or their love handles, and it gets melted away. Do you end up with loose skin as a result?
Well, that's an excellent question. We have 3 or 4 devices that can kill fat non-surgically. Cool Sculpting freezes the fat. Sculpture heats
That's the one
fat.
I'm reading about,
Yep.
Sculpture. Yeah.
Sculpture heats the fat and causes a hyperthermia. You're right. And sort of think of, you put the butter in the microwave and it liquefies it.
Yeah.
And then we have UltraShape, which uses ultrasound to gently ultrasound and cavitate to implode the fat cells. And then we have something called Body Effects that electroporates, uses electrical current to damage the cell membrane. So we've got 4 ways we can kill fat non-surgically with no risk. And so 2 things you need to think about. First of all, what happens to the fat? Is it safe? Well, your body has very good mechanisms for cleaning up free fatty acids and glycerol. And I tell patients, look, you do this over 1 or 2 treatments over 12 weeks, and you're going to melt 400 or 500 cc's of fat, which is two measuring cups. But if you go on a diet over 12 weeks, you're going to metabolically shrink sometimes 10, 15, 20 pounds of fat, and your body is more than able to mobilize that. And number 2, it's very important we combine the Sculpture, the Cool Sculpting, the Body Effects, the UltraShape, the fat killers, if you will, with skin tighteners, because it's no different than liposuction. You take that fat away, and sometimes the skin looks, and we've all seen pictures like, Tara Reid type of tummy.
Yeah, that's what I immediately thought of.
Yeah, the skin looks kind of nasty, so it's very important to tighten, whether you're doing internal liposuction, and tighten if you're doing non-surgical fat destruction. And so we use radio frequency devices to tighten the skin at the same time as melting the fat. So you can, you have less fat, but your skin looks attractive.
And we have to take a break, but just still on that, when you melt the fat, as opposed to when someone loses fat, it shrinks. When you melt the fat, where does it go?
Well, you have these little molecules that will pick up the fat that's in the non-cellular space of your body. Let's say your saddlebag or your bat wing or your waddle or your pot. We've got all these attractive adjectives, and it's hanging around there. And these little molecules take it back to your liver. Your liver processes it, recycles it, if you will, and this Krebs citric acid cycle, and turns it into energy, so you can go out and get another bucket of Kentucky Fried Chicken.
Yeah, exactly. All right. We've got some calls coming in for Dr. Stephen Mulholland. We're just going to take a quick break and get right to them. Welcome back to the show. We've got Dr. Stephen Mulholland here for the hour, one of Canada's leading cosmetic plastic surgeons. The company is SpaMedica, and I keep forgetting, is it .com or .ca?
SpaMedica.com.
SpaMedica.com, and we've got him here for the hour. So if you have any questions about things that are bothering you, procedures you've been considering, give us a call, 416-872-1010. You can text us at 71010. We've got a few people lined up to talk to you, so we will get started right away. Susan is first. Hi, Susan. Welcome to the show.
Hi. Thank you for taking my call. Thank you, doctor. I have a question for you. So by the time I finish losing another 30 pounds, it will be a total over the last few years of 90 pounds.
Congratulations.
And I'm going to be 60 next month, and I'm on a plant-based whole food diet, so that's my lifestyle now. And that's how I've gotten rid of all of the weight. I'm getting rid of it. But my problem is it's going to be a lot of sagging skin. especially at my age. And I'm using a walker, so I can't do a lot of exercises and weightlifting and whatnot. So what is the best way to get rid of the hanging fat, and what kind of a cost would it be?
That's a common question, Susan. First of all, congratulations on losing that much weight. That's a lot of discipline. So I do see a number of patients who have, through their own hard work and discipline, such as yours, have lost significant amounts of weight, 100 pounds or more, or through surgical manipulation of the stomach, like you've heard of lap banding and gastric bypassing. And once all the weight loss is done and everything's settled and you're much healthier, and maybe your type 2 diabetes has gotten better and your hypertension is improved and all these great health benefits, you look in the mirror and go, oh my goodness, where did all the skin come from?
Yeah.
Because of course it's very hard for that skin to recoil, number one, when you're not quite 22 anymore, and number two, when you've lost a lot of weight. And so we do have non-surgical techniques, skin tighteners, products you probably read about like Venus Freeze and Exilus and Forma. These are radiofrequency current devices that will tighten the skin that's modestly lax. When you've lost a lot of weight, however, usually you have shards and shards of extra skin, and it can be of the neck, of the bat wing or the arm, or the above the knee, particularly the inner thigh and the tummy. And unfortunately or fortunately, the best treatment is usually just excisions. You could go into a big procedure called a total body lift where everything is done at once. However,
Wow.
I find that's a bit too risky, and we tend to break things into things that people can see and you can't hide, like the neck. And then maybe things that are very annoying and make it hard to wear a nice form-fitting clothes after 100 pounds, like a tummy tuck, and then maybe an inner thigh lift, and then an arm lift. And those 4 procedures, neck, arm, tummy, and inner thigh, are the most common and popular post-weight loss lifts. Now, depending on who you see, there will be a range of price in this country. It can be in smaller markets and provinces where there's less cosmetic plastic surgery. You might be looking at paying anywhere from $4,000 to $8,000 for each of those lifts. And bigger cities like Vancouver and Toronto and Montreal, you would look to be paying between $7,000 and $10,000 for any one of those lifts.
So in other words, I have to learn by hanging the fat.
Yeah, well, unfortunately, yes, it's not inexpensive, this type of surgery. And sometimes if you've got symptoms such as recurrent infections under the belly skin, you can see your family physician. They would refer you to a reconstructive plastic surgeon, and that can be applied to OHIP and see if it'll cover that.
I was going to ask about OHIP.
But the neck and the arm and the inner thigh is almost never covered, but the tummy sometimes can be.
And what about scarring in terms of those? Because it sounds like it's a lot, having to remove all the skin.
Plastic surgery is not about having no scars. It's about placing the best possible scars in the least obtrusive location. For neck lifting, we can hide it behind the ears.
Wow.
For inner thigh, up in the groin crease. For the tummy, we generally put it right through the pubic hair area and into the groin crease. So, yeah, the scars can be quite long. We're usually good at making them white and hiding them in the least conspicuous areas. But most patients who've had massive body weight loss, such as Susan, and have loose skin, are very unconcerned about the scar and just want to have a tight skin envelope again.
Sure, that makes sense. 416-872-1010. You can text us at 71010. Dr. Stephen Mulholland is here, one of Canada's leading plastic surgeons. SpaMedica.com is the website. And Julia is next. Hi, Julia.
Hi, I was wondering about the safety of breast implants. It's something I've been considering for a long time, and recently I've read some articles regarding cancer-causing, gel implants or saline implants, also autoimmune disorders, kind of long-term effects.
That's an excellent question, and one that needs to, during a consultation with a plastic surgeon or surgeons, you probably want to get 3 consults. You would raise what are the known risks or the possible risks, and most of the known risks are just things that are local and fixable, like maybe a wound infection or fluid in the breast pocket that can be drained. But the more serious things that are potential risks, although not proven, are things like autoimmune diseases you mentioned, like rheumatoid arthritis, lupus, scleroderma. The detection of breast cancer with an implant in there is a concern that we always talk to our patients about. You can detect breast cancer with MRIs quite easily with breast implants in place. And then chronic or acute lymphatic leukemia or lymphomas associated with breast implants, multiple sclerosis, ALS. But there's no health regulatory body in the world, not Health Canada, not the FDA, not the EU, not Australia, that feel there's any connection ever proven between these diseases. You can have breast implants and then some years later get a second disease. It doesn't mean that disease is related to the implant. And so there was some concern in the 90s regarding silicone implants related to rheumatoid arthritis and lupus. They did some exhaustive epidemiologic studies and they didn't find there was any link. However, you will find some websites where women who have those diseases feel passionately that the implant did cause them. And I always say to women, it's very unlikely that any of these worldwide government organizations would ignore research that indicated there was a problem. However, maybe one day we'll find out they do cause problems. And so I put that in the list of risks that you need to consider. And for those patients really, really concerned about that, often fat grafting to the breast is a great option because it's natural. There's no known risk with it. You can't get this, go from an A cup to a double D with fat grafting, but you can certainly go up a cup size, and a cup size and a half over a couple of sessions. And most patients that are breast implant wary are very happy with this option.
416-872-1010. We will continue on with your calls. Tracy, Mary, Julia, Josie, hang on. We will get to your calls just as soon as we return. Cosmetic plastic surgeon Dr. Stephen Mulholland is here from SpaMedica, and we will be right back. You're listening to The Night Side. Welcome back to the show. Dr. Stephen Mulholland is here from SpaMedica.com. He's one of Canada's cosmetic plastic surgeons. And if you have been thinking about something that's bothering you or maybe a procedure you want to know more about, give us a call at 416-872-1010. You can text us at 71010. We had a caller earlier who was talking about losing large amounts of weight and what it would cost to have the sagging skin removed. And you acknowledged per area, it is quite expensive, but there was something else you wanted to mention about that.
Yeah, I should have mentioned with Susan that upwards of 70%, 70, of all patients finance their cosmetic surgery. And there are several finance companies, iFinance Canada being the biggest, that service over 12,000 doctors in the country. And patients generally finance their procedures. So it's, rarely do you walk into your Ford dealership and say, here's $15,000 for my Prius in cash. And so most patients will get financed by a company like that in about 30 minutes over the phone.
Through the doctor's office.
Through the doctor's office, the coordinators will help the patient look for a source of funds. And usually the approval process is quite simple, a simple credit check. As long as you have a reasonable credit score, you can get your money at 6%, which is a bit higher rate than the bank, but there's no cosigner. It's a simple process. You don't have to go into your bank manager and explain why you're getting breast implants. Yeah. Of course, if you default on your payments, they'll repossess the implants. That's the one downside.
Yeah, you're going to find a way to take it back. No, well, I guess it's just the regular people.
But in general, it's not less expensive than you think. For example, in my office, we have in the coordinator's office, there's an arrow to every part you could have a surgery: eyelid, nose job, jawline, hair transplant, breasts, tummy, and a little number beside that arrow of what it would cost per month. Most procedures cost you between $100 and $120 per month for 60 months. When you think of a life-transforming procedure that you're going to have the rest of your life, that's reasonably affordable.
Well, and as Susan called in, when you've lost a large amount of weight and you've got skin literally hanging off your body, that would be a very uncomfortable way to continue
totally. And
on.
she could look at a tummy tuck to remove the skin, maybe tighten some muscles. And over 5 years, she'd have $110 to $120 a month in payments, which is generally reasonable if you budget for that in any kind of family budget.
I think for the most part, we're going to get right back to the phones, but for the most part, do people have to understand that the majority of cosmetic plastic surgery is not going to be covered by OHIP?
Cosmetic plastic surgery, nothing's covered. In reconstructive plastic surgery, remember, plastic surgeons, we also do facial fractures and cleft lip palate and hand injuries and hand fractures and burns and, breast cancer reconstruction and got defects all over the body. That's all covered by HOIP.
What about breast lifts for women who just have very large and heavy and have back problems?
Yeah, so breast reductions. You do get a lift effect, but they're called reductions, and they are covered by OHIP if you have the triad of symptoms, which is usually neck and back pain. If you have skin abnormalities, inflammation under the breast, dermatitis because of the chronic moist area, and then of course if you have to buy custom bras or bras are digging into your skin and causing ulcerations. So those are the symptoms usually that OHIP will cover.
416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here, and Tracy is next. Hi, Tracy. Welcome to the show.
Hi. Thank you so much.
Sure. Go ahead.
So what's bothering me, I'm a 52-year-old woman, pretty newly divorced. I'm quite fit, and I'm thin, so my cheeks are really hollow with laugh lines, because I've laughed a lot, which is a good thing.
Yep.
But I guess my question is, what's the most effective way to fill the cheek or, help with the laugh lines? I've looked into, or online at least, filler. And I've also, more of at a cosmetic place, they were trying to sell me on this, they call it non-surgical facelift, more with a mask. And they were offering sort of this once a month for 12 months. I think they said it was magnesium and it's good for 5 years, but it was a lot of money, like $3,000. So my question is, what's the most effective way to deal with that issue?
Well, those are common questions, and the answer is usually going to be divided into non-surgical and surgical options. Generally, you've got day spa solutions such as masks and peels and facials, and they're temporary and they're improvement. But you sounds like you've had, you're physically fit, you're just peri or postmenopausal, you've had a lot of body fat loss, and you do get some facial fat loss, and this loss of volume can make you look a little gaunt or a little tired or not as youthful. That fullness of youth is there for a reason, and so fillers are usually your best option for loss of volume. Fillers can be divided into those biologic type of fillers, like your own fat. Steal it from where you've been saving it for a rainy day and put it where you need it. Of course, if you're thin and fit, fat may not be an option because you may not have enough. And then off-the-shelf fillers like Juvederm and Voluma, which can last a year or more, are very good options and usually quite affordable. Around the eyes, the squint lines, the crow's feet, usually managed well with Botox. That would have to be done about twice a year to soften the lines. If they're permanent at rest, you can do fractional lasers, which will improve the lines, including upper lip lines and other fine lines, and then Botox and soft tissue fillers to maintain your volume. And finally, for true lifting and sagging skin, we've got some great devices. There's a new one called the Profound, which uses radio frequency energy and little needles under local anesthesia to tighten your skin in a single session. And so all these are doctor-driven, proven, efficacious, have very low risk factors. And most women, I tell most women in your 50s, you can look 7 to 8 years younger without ever taking a scalpel up. And by these combination treatments of light and energy devices, Botox, fillers, you can look great forever and never have to have surgery.
Okay, thank you.
And then, of course, don't forget more fish, plenty of fish in the sea and Tinder now that you're recently divorced.
Yeah. Now, the things that are non-surgical that you're talking about, are they also able to be financed?
Yeah, so the non-surgical treatments can be financed. And if you're doing a big non-surgical treatment like a cool sculpting session and you want to do your tummy and your hips and you're going to spend $2,000, $3,000, $4,000, you can finance that. But the smaller ticket items, most patients do pay cash for that, or they finance it typically on credit cards.
Sure, of course. Mary is next. Hi, Mary. Welcome to the show with Dr. Stephen Mulholland.
Oh, hello. I just want to ask Dr. Mulholland, I'm not overweight, never have been. My younger sister in England, I'm in my 60s now. I'm not well, but I'm okay. And she said that I was the only stick insect she knew that had cellulite. Is there anything that can be done for cellulite, and how much would it cost? Because I'm getting to that stage in my life where I just want to look really good.
Well, I think any age is a good age to commit to that goal. Of course, I'm somewhat biased. Cellulite is that lumpy, bumpy cottage cheese type of skin. It can be quite deep and pitted and nodular like cottage cheese, or it can be quite fine and granular like an orange peel. In general, for the finer types of cellulite, like orange peel type cellulite, we generally use non-surgical techniques, bulk heating radiofrequency devices. The Venus Freeze is a common one. The Forma, something called Smooth Shapes, Exilis. You do a series of 6 treatments. You get about 20% improvement, which doesn't sound like a lot. And you need to come back once every 3 months to maintain it, sort of like doing your hair and coloring your roots. If you have more serious cellulite, the lumpy, bumpy, pitted cellulite, more common on the buttock, posterior thigh, and outer thigh, then we have an internal laser called the Cellulaser and a radiofrequency device called Cellutite. I do those procedures myself, not my estheticians. It's done under local anesthesia, and you can get up to 70% improvement. The nice thing about this technique is that it's long-term. It lasts for years. And cellulite is quite a random and capricious enemy of the skin. I've got many patients who are Rubenesque and full-figured gals and completely smooth, and skinny little minis who exercise like maniacs with horrible cellulite. So it's not dependent upon weight. It's a hereditary and a hormonal issue. And up until recently, we didn't have anything to treat it. Now we do. Average pricing, non-surgical techniques would be in that $2,000 range for the series of treatments, and then about $250 for maintenance treatments. For the surgical, it's in the $6,000 or $7,000 range. But again, it's a one-time treatment with no need to do update and ongoing treatments.
416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here taking your calls. Welcome back to the show, and we've got some great news. Dr. Stephen Mulholland has agreed to stick around a little bit after 9 o'clock, so we'll make sure to get to all of your calls. 416-872-1010. You can text us at 71010. He is one of Canada's leading cosmetic plastic surgeons. I only say one of so that I don't anger all the other plastic surgeons who are out there listening, but you're probably the biggest in Canada.
Yeah, we're very fortunate this country to have some really well-trained plastic surgeons with good reputations. And I always encourage, patients who are looking for plastic surgery, get yourself 3 consultations. Do your research online, of course, websites and rating sites like Real Self or Yelp or City Search. Go on the College of Physicians and Surgeons of your province. Check out the doctor. Make sure they are certified in plastic surgery. Check out the CMPA. Make sure they don't have any lawsuits. Although that doesn't necessarily mean that they are a bad surgeon, because it just means they're busy and maybe had a crazy patient. I've been in practice for 24 years, never been sued. But these are the things you want to look for. And then, of course, during the consultation, you want to be interviewing the physician as much as they're interviewing you. How many cases, how long you've been in practice, how do you manage complications? Can you speak to some patients personally? Good before and afters. And you get a good sense of the team. The team is going to be looking after you. So those are some of the things that I would do if I was going around looking for options, and I would always see at least 3 surgeons to find the right one and the right fit.
All right, we go back to the phones. Josie in Etobicoke has been hanging on for a bit. Hi, Josie. Welcome to the show.
Hi, thank you for taking my call. I'm calling in regards, actually, I believe it was Tracy who had mentioned the Botox treatments and Juvederm.
Yep.
My question is, I'm thinking of doing a bit of touch-up with the Botox, but I have a friend who was doing it faithfully for about 8 years, and for the last 3-4 years she stopped doing them because of financial issues. Now my question is it something that you have to do all the time? And if you don't, how quickly will the results be that you haven't maintained them?
Sure.
That's a great question, and one of the corollaries to that is some patients will say, well, if I stop doing it, will it accelerate my aging process? And so there's a lot of urban myths around Botox, and generally Botox is one of the very first medical things that women will do as they age, and they're now in their early to mid-30s. Stop the forehead lines before you get a crease, the number 11s between your eyebrows, treat the crow's feet, and if you start early enough, you will never, ever, ever form those lines. It's really quite incredible. Now, let's say you start when you're 32, 33, 34, and you don't like the frown lines your mom had, and you're going to get them. So you start doing Botox twice a year, and you're 42 years old, and you stop doing it. You won't have any lines, number one, and you'll start getting creases just like you were 32 years old. So
Oh, wow.
your muscle will return. It will start to work again. But you've delayed 10 years the lines you might have gotten. And I've got patients I've been treating with Botox now for over 20 years, and they don't have a single line in their face where you would anticipate them: crow's feet, frown lines, or worry lines. So Botox can do many things. It can soften lines. It can reshape your brow, give you a bit of a brow lift. Juvederm can give you the volume in the lips or the cheeks you might not have inherited, and it can even improve the appearance of your nose. So simple injectables, both Botox and soft tissue fillers like Juvederm, are great options. Generally, you'll have to do Botox twice a year, sometimes 3 times a year if you're very, very expressive. And the soft tissue fillers will last often a year or 2. And so, though, you have to budget it. You have to think, if I'm going to spend $2,500 a year looking my best, it's no different than adding up, 6 or 7 haircuts with color and all your pedicure, manicures. However, most of these things will make you look significantly younger. So I would just bundle them with your cosmetic commitment to hair and nails.
Hair alone can be extremely expensive for women.
Very much so.
Yep. Okay, let's go next to Steve. Hi, Steve. Welcome to the show.
Hello.
Hello. Hi, good. Thanks for holding. Go ahead with your question.
Thanks very much. Dr. Mulholland, I have a problem around both my eyes. I have, cystic bumps around towards the end of each of my eyes.
Uh-huh.
And I had them, I went to a dermatologist who injected it with, I believe, lidocaine to try and shrink it.
Mm-hmm.
And it didn't help.
And when you say cystic bumps, how big would those be, Steve? Are they the size of a pea? Are they tiny in a bunch of them?
I would say about half the size of a pea.
Yeah, okay. And is it just one, a singular, or you have a number of them?
I have one big one, about half the size of a pea, and then a few others that are much smaller.
Okay.
And I'd like to get them removed.
Yeah, so there's a number of things that can grow around the eyes. And of course, it's quite disturbing when you have that, because eyes are the window to the soul. And everyone's looking in your eyes. And of course, it can be distracting to have these little bumps.
Right.
And so there's different types of bumps. You can get little cholesterol deposits that are yellowish. That's called xanthelasma. You can get little benign growths of your sweat glands. These are called cylindromas. There's all kinds of little horrible growths that we can get around the eyes. And generally, the eyes are very, very forgiving. So if you saw a good plastic surgeon that does blepharoplasties, like eyelid surgery, they'd be able to make small little incision, probably remove that cyst, put a little stitch in there. It would look just like one of your eye crease crow's feet lines. And the smaller ones are probably able to be lasered off with a CO2 laser, or what's called a bifurcator, which is a little RF needle. And so I'm sure that you can make a tremendous improvement in these nasty little growths. And so just seek out a plastic surgeon that offers that.
All right, Steve, thanks a lot for the call. Let's try to get one more in, but we are going to continue on after 9 o'clock with Dr. Stephen Mulholland. We'll see what we can fit in before the top of the hour. Al is in Mississauga. Hi, Al. Al?
Hello there. Thanks for taking my call. I had an accident last year where my tip of the 2 fingers were lacerated due to a lawnmower. I was wondering if there is a reconstruction procedure that can be done, and whether or not would it be covered by OHIP or not?
So quick question. When you say lawnmower injury, did it take the soft tissue pad off? Did it take the nail plate off? Did it take
So in the index finger,
yeah.
It took almost to the bottom of the nail bed.
Okay.
I still have a small regrown nail.
Yeah.
In the index finger. In the middle finger, it almost took up to the first knuckle.
First knuckle. And was this an amputation or just a laceration?
No, it's actually, I'm sorry, the correct term, it was amputated, yes.
Okay, so you have an amputation through the last joint of one finger and through the last part of the bone of the other. And so right. You probably underwent an amputation revision. You would have probably seen a plastic surgeon who facilitated closure.
Yeah.
And they did a little
right.
flap. And so in some cultures and for some patients, not having a complete finger can be quite disturbing and visually unappealing. You have 2 options, and they're all covered by OHIP. Number one is get a prosthetic attachable finger that can be matched perfectly for your skin tone, color, finger size, width, and length, and nail plate. They look extraordinarily real.
Wow.
And that's your simplest option. If you had an amputation from the middle joint to the big knuckle, you can undergo a toe to a finger transplantation. And if it's a thumb, it's called a toe to thumb. And those auto transplantations are done by plastic surgeons, reconstructive plastic surgeons. But when it's through the middle joint, rarely do those auto transplantations work. They're not as aesthetically appealing as a prosthetic. And most, if not all, plastic surgeons would just say, unfortunately, we can do the surgery. It rarely looks good. It's usually not functional. And so you should go for a prosthetic. Sunnybrook Hospital is one of the city's trauma centers, and they have an excellent prosthetic unit. See if your family doctor can refer you there.
Lena has been holding for quite a while. Hi, Lena. Welcome to the show.
Hi.
Go ahead with your question for Dr. Mulholland.
I'm just wondering, if you have breast implants, how long can you keep it on before you need to replace them?
That's a good question, Lena. And there's a lot of misconceptions, and it has actually changed. So with the new brand of cohesive gel, these are gummy bear type implants, kind of the consistency of Jell-O. They're not liquid. The cohesive gel implants are sold to plastic surgeons by one of the largest pharmaceutical companies in the world called Allergan. They're an Irish company, about the seventh largest pharmaceutical company in the world, and they have all kinds of different products and services, but they feel strongly enough in their cohesive gel brand that they warranty patients lifetime warranty that
wow.
if they fracture or if the shell becomes defective in any way, shape, or form, they will replace them free of charge. So with the cohesive gel implants, it's lifetime. With the saline or salt water implants that are filled with saline, a kind of a physiologic water, you get a 10-year warranty. After 10 years, there's a huge probability the saline implants would have leaked. The saline implants have the leaking problem. They tend to show more ripples. They don't feel as natural. They have the advantage of being able to put in through the belly button or through the armpit. And in general, they've been around for 40 years. The cohesive gel implant's been around for about 14, 15 years. They get the lifetime warranty, don't tend to ripple, feel like a breast, and they have to be put generally in through and under the breast incision.
Okay, we've got Zach on the line with a question for Dr. Mulholland. Hi, Zach. Welcome to the Night Side.
Hi there. Can you hear me okay?
Yep, we can hear you just fine.
I hear you good, Zach.
How's it going? I know you don't have much time left, so I'll try to be quick. I just basically have a question about nose jobs. I'm sorry, I don't know the
Yep, nose jobs. Common term is nose job.
Okay, and how long would I need? Would I need to take time off of work? And what is the healing process like? And is it different depending on what degree of, like, how bad my nose is, basically?
Well, it's a good question, Zach. And in general, guys, noses are one of the more common things a guy will do, as well as lower lid bags and a double chin and a 50-year-old male breast and love handles. Those are the top 5 guy things. So noses, I did plastic surgery. I did training in ear, nose, throat, head, neck oncology. So I do a lot of noses. And a lot of guys have sporting noses, I call them. The old hockey nose, like old Mike Foligno type of nose.
Yes.
Where you have a broken bone and you have a big bump and maybe it's overprojected and it's long and maybe even way off to the side, is crooked, and there could be some breathing obstruction. So that's usually a result of trauma, sometimes of development. The most common type of guy nose is called the reduction rhinoplasty, making it smaller. And one of the most important things is do imaging before. So I always sit with patients. We go in front of a computer, and in 2 and 3 dimensions, I show them the kind of changes I think they're looking for based upon discussions. And I'm very good, as most plastic surgeons should be, getting that computer image to look like the nose that you're going to end up with. So it's sort of a, try before you buy.
That's a great thing now.
And it really eliminates on dissatisfaction. And then your question, remember with the nose, we have to break the bone, we have to file the bump down, we have to shape the cartilage to suture them all together. The nose looks like high dome, he hit you with a hockey stick at the end of the procedure, and you need about a week for that to recover. You're going to be bruised and looking quite swollen, which may work on the 30th of October, but won't work most other times of the year. And so you need about a week off work, and you sometimes have raccoon eyes under the eyes from the bruising. But generally, if you do this on a Thursday, you could count on being back to work a week Monday. About 3-4 days in, the packing comes out of your nose because often airways have to be improved, and the cast comes off in a week. There are no stitches left on the outside, and most of the stitches are on the inside. And you usually make up an excuse like, I got my nose hit by a baseball, or I hit a cab door, I had too many libations and I slipped and hit the edge of the bar stool, or my wife got in an argument and she hit me with a frying pan. There's any number of excuses that would account for what your nose might look like at 10 days. So you'll be back to work on the 10th day.
Dr. Stephen Mulholland, thank you so much. We really appreciate you coming in every once in a while.
Thank you very much again for having me. Always fun.
And the website is SpaMedica.com.
You've been listening to a segment from the Best of the Night Side with Barb DiGiulio podcast. Log on, listen, and download the latest podcast right now by visiting Newstalk1010.com.